Здравствуйте and good evening and welcome to NU. This evening we are here at Nazarbayev University for the 113th Global Health Histories seminar to discuss a very important topic, immunization. But before we get to that conversation, I would like to thank the various people who have helped us put together this event. I thank our speakers, Dr. Nazarbayev University, who flew here yesterday, and Dr. Byron Craig, who had a rather shorter commute to the event, but whose presence is no less important for that fact. I would like to thank the various organisers at the World Health Organization, and in particular the WHO Collaborating Centre for Global Health Histories at the University of York, and my kind and supportive colleagues from both faculty, administration, and for that matter, the marketing department here at NU, without whom this event would quite simply not have taken place. I am excited to say that in the audience we have NU students, faculty, and representatives, I believe, from both the WHO and UNICEF. So I thank our audience, both local and international, for making the time to be with us here tonight. The Global Health History seminars are a hugely important venue in which scholars from clinical medicine, public health, and medical humanities can all come together and share perspectives and expertise. In order to do that, we need to think about the relationship between contemporary and historical medical practices. There is a popular idea in the history of science and medicine that that history is a story of progress, where we just keep getting better and better and smarter and understanding the world in better ways. Those of you in the room who are my students know that I have any number of problems with that particular view. Our topic today is a perfect illustration of one issue in this idea of the march of progress in the history of science and medicine. So immunization, this creating resistance to certain diseases through vaccination, has enormous benefits for the health of the population. So if we were to follow this model of progress in science and medicine, surely we are only getting better at vaccination and immunization. Yet actually, the opposite seems to be true. Dr. Ganeri is going to tell us today about the eradication of smallpox, which was a 20th century project. There was also in the 20th century an attempt to eradicate polio that did not entirely achieve its goals, but in the decades since 1988, there was a massive drop in the cases of that particular disease. The greatest successes of immunization were in the 20th century. In contrast to those great successes of the 20th century, there have been well-publicized problems with immunization in the 21st century, including recent outbreaks of diseases for which immunization and vaccination has proved to protect against. Dr. Craig will tell us about the issues currently facing practitioners with regard to vaccination and immunization. So it's interesting here that the European Centre for Disease Prevention and Control have been recording cases of measles. So measles is a disease that we can vaccinate against. Since 2017, in the EU alone, there have been around 14,000 reported cases. And since 2016, 57 deaths. A report on this states, quote, "The continued spread of measles across Europe is due to a suboptimal vaccination coverage in many EU and EEA countries. Of all measles cases reported with known vaccination status, 87% were in unvaccinated individuals. Many of those 57 deaths were preventable using medical practices we have available to us right now." So the history of vaccination and immunization is not a march of progress, but actually more like a bell curve, where the massive successes of the 20th century have been followed by very serious problems in the 21st. The reason that we are holding this event today and here in Astana, capital of the Republic of Kazakhstan, is in fact for important reasons referring to the past and the present of healthcare. 2018 is the 40th anniversary of the Declaration of Alma-Ata. In 1978, an international conference held down south in Almaty declared that primary healthcare should be a major part of achieving the aim of health for all. And this week, scholars from around the world have arrived in Astana to renew those discussions of how best to achieve global health. So you will see on Twitter and certain places the hashtag Astana 2018, and that relates to a series of events in Astana this week related to that. So, hashtag Astana 2018 and our event today is about the past and it's about the present, but it's also about one topic for which I actually happen to have picked up the Kazakh word, which is boloshak. Even for those of us who live in Astana with extremely limited Kazakh skills, have picked up the word boloshak because in Astana we are always thinking about the future. We have our futuristic skyscrapers. We had the Astana Expo last year, which was all about future energy. And this week, we, various people in Astana, are here to think about the future of healthcare. So, tonight, we will be considering both the past and the present of immunisation in order to help develop perspectives for the future of immunisation and vaccination. So, I will now introduce our two speakers, and we shall proceed in a neat historical fashion. So first we will have our historian, and then we will move on to our public health expert. So I am very, very happy to introduce Dr. Namrata Ganari, who has flown into Astana just yesterday to be with us here this week. She is currently Commonwealth Rutherford Fellow at the University of York's Centre for Global Health Histories. She is on study leave from her permanent position as Assistant Professor in History